Hello everybody and welcome to our July LINEA webinar, which has proven to be very popular as we have over 100 people registered for it. My name is Anna Maria Buller and I'm the LINEA project coordinator. As many of you know, LINEA is the learning initiative on social norms, exploitation and abuse of children and adolescents. We are based at the Gender Violence and Health Centre at the London School of Hygiene and Tropical Medicine, and our aim is to foster the use of the social norms approach in the prevention of the sexual exploitation of children and adolescents. As part of the LINEA activities, we organize webinars every 2 months dealing with different aspects of social norms and sexual exploitation. For those of you who join us for the first time, you can sign up to the LINEA network and receive future communications about our activities and webinars at linea@lshtm.ac.uk. Also, I would like to let you know that today's webinar would be audio recorded and posted in our YouTube channel. Today, I'm pleased to introduce our fantastic presenters. Dr. Nancy Glass, Professor and Associate Dean at Johns Hopkins School of Nursing and Associate Director at Johns Hopkins Center for Global Health. Julian Barr, who's co-chairman of a monitoring and evaluation consultancy, ITAD Limited, based in the UK, and also results director of Voices for Change in Nigeria. And Emeka Nwankwo, results and measurement lead for the DFID Voice for Change program in Nigeria. Today, we're lucky to have these experts in the field sharing with us some of their fascinating and challenging experiences measuring social norms. In particular, they are going to be presenting on case studies where social norms were used to address gender inequality and sexual violence. First, we will have Emeka and Julian presenting on their approaches measuring social norms changes in the Voices for Change program in Nigeria. And then we will have Professor Glass presenting on her experience on working with social norms in humanitarian settings in Somalia and South Sudan. At the end of the presentations, we will have time for questions and answers, and we would welcome everybody's questions and comments. Okay, so now I would hand over to Emeka, and we will get started.
Hello, everyone. My name is Emeka, and I will be co-presenting with Julian Barr. And as an outline, we will start off with an overview of Voices for Change program, and then discuss the theory behind our measurements. Thereafter, Julian will discuss our measurement approach and then round up with some findings from our baseline study. So Voices for Change is a 5-year program that is implemented in Nigeria and funded by the UK Department for International Development. The ultimate goal is to challenge discriminatory social norms in 3 broad areas, namely violence against women, non-acceptability of women in leadership, and non or limited involvement of women in decision-making. The program combines learning from development with learning from communications, behavior change, and social norms. Hence, V4C works with local partners in Nigeria to implement programs that would help girls and women to be in control of their lives, that would change perceptions and stereotypes about gender roles through the promotion of new social norms, that would also support the formation of new partnerships with men's organizations, as well as with traditional and faith-based institutions to reinforce changes in societal attitude towards girls and women, and importantly also strengthen gender-related regulations, women's political participation, and ensure budget response to women's needs. You may read more about the program from its website, www.v4c-nigeria.com. So in V4C, this is how we understand social norm. We see it as a norm that is a set of social expectations shared within a valued reference group. And we believe that with the recent social norms theory that suggests that we are all social creatures who are influenced by what others say, do, or believe, and what we think others say, do, or believe. And with reference to this definition, there are two types of norms that we look at. Descriptive norm, or we can also call it empirical expectation, which is what others do, and injunctive norms, the normative expectation, which is what you should do. Now, since social norms are interdependent, for instance, I do something because I believe others expect me to. Therefore, changing a social norm entails changing current social expectations and creating new social expectations, or both. Now, in a social norm model, there are two possible pathways for change. One is that attitude change before behavior change, which is a more conventional individualistic model. This route to change is more likely where the desired new behavior is not easily visible to others, and therefore people do not see others modeling the new norm. An example of such a behavior might be domestic violence. Now, there is the other pathway for change, which is behavior changes before attitude change, where individuals change to a new behavior because they see others change around them, although they might not change their attitude. Now, this route is more likely where the desired change is clearly visible, clearly public, such as child marriage, and therefore subjected to social regulation and peer pressure. Sometimes we have also seen social practice that is not conditioned by social obligation. Hence, change in practice may be close to change in attitude and tend to be gradual. And sometimes change in attitude can come after a major shift in the practice, and this may be rapid. Now, in a social norm situation, assuming equal effort over time, attitude may change before action, or action may change before attitude. Therefore, measurement of the progress of an intervention ought to allow for both possibilities, that is, attitude before behavior or behavior before attitude. So in V4C, we have identified two pathways for behavior change, but we cannot foretell what the tipping point for change will be. As yet, we do not know whether to expect a long period of preparation followed by a relatively quick change in behavior, or a gradual and steady change over time. We must allow for the fact that change may happen because an individual sees the value in doing so, or because individuals believe that this is how others now expect them to behave. So our measurement tool has been designed to capture these different pathways of change, and we've called this tool the CAP4 matrix. The tool plots changes, as you can see, in attitude from old to new on one axis and changes in behavior from old to new on the other, giving us a 2x2 grid for change in both personal and social norm. Now, the knowledge about social norm issues play a role in shifting attitude, and for social norm, this also includes knowledge about others' beliefs and expectations. And by measuring both individuals' current attitude and actions, we can benchmark towards the goal of willing and sustainable abandonment, which is the fourth box in the matrix, regardless of the change pathway. Now, to deepen our analysis, we adopted another social norm framework that was developed by the University of California, San Diego. Now, what is the CAP4 matrix? That is the table I showed you earlier. It's helping us to understand what individuals are, where individuals are in the continuum of change, and what are the likely tipping points. This framework allows us the opportunity to measure the expectations of other people. These are the cells that have been identified by the green border. You will see the other cells under others, first order expectation and the second order expectations. Now, this enables us to understand if there is a social norm at play and what is the intensity and uniformity of the behavior or norm. Now, social norms, as I earlier said, involves one's own expectation about others and one's understanding of others' expectations. So we included these dimensions in our measurement design. And I'll hand over to Julian, who will discuss our measurement approach and the findings.
Thank you. Yeah, thank you very much, Emeka. So I wanted to now talk a bit about how we've translated the theory of social norms into the practice of trying to measure it. So we have just finished a baseline study where we're aiming to do a baseline 2 annual follow-ups in year 2 and year 3, and then an endline study in year 4. And the baseline has just finished reporting this week, so we've got draft findings as of this week. And our strategy was first of all to do some explorative qualitative work, which was with some focus group discussions with groups in different parts of the country to find out around the particular sort of discriminatory practices we're interested in, how people talk about them, if at all. Are they public issues? Are they private issues? What's the reference group that's associated to that? So if it is a social norm, who is defining and pursuing the social norm? Who are the key opinion formers in relation to the individuals that we're talking to? And I should clarify that we're particularly, for our purposes, interested in talking to 16 to 25-year-old boys and girls, because our interest is to work with that group as an age cohort that, as they get older, will become the next generation of opinion formers in their groups and in their communities. The third question that we asked in the exploratory work is, who are the people that matter most to the particular practices? And just to repeat what Emeka said, the practices we're interested in are domestic violence, domestic decision-making, and women's political representation, women's representation in political spaces. And then finally, in the exploratory work, to establish what, if any, sanctions exist if there is non-compliance or compliance with the particular practice, with the norm. And that's then helped us refine a set of questions, a set of very detailed questions, which we've used to design a questionnaire instrument, a survey instrument, which I'll go on and talk about. And we've then gone on and implemented a full survey and some follow-up qualitative focus group discussion work with particular groups to try and understand some of the answers we're getting through the survey, and to explore some of the issues around social desirability bias in some of the answers that we're getting. And the sort of the essence of the survey is around the social norm areas we're interested in for the program, to find out what people typically do and what do they think is appropriate for people to do in their particular area. In terms of the practicalities of the survey, we've surveyed 5,000 boys and girls in the 16 to 25-year-old cohort in 4 states in Nigeria, 2 in the north and 2 in the south, and 1 in each of the north and the south is urban and 1 is rural. So in the north we have urban Kano and rural Kaduna, and in the south we have urban Lagos and rural Enugu. and our sample is split fairly evenly between those 4 states. And we employed a professional survey company who we trained and did some piloting with to enumerate the survey for us, and then working with academics at the Statistical Services Center at University of Reading and University of California at San Diego, we've analysed that data. Again, to reiterate, we've been focusing on 3 survey modules around the 3 norm areas we're interested in: household decision making, violence against women and girls, and political leadership. And we've asked those around the matrix which Emeka was talking around, both normative and empirical information. What do I do and what do I think I should do? And to try and get perceptions of what neighbours do and what we think neighbours think we should do. So we get the full triangulation of social norms. That survey, for example, the way we've asked the questions is to paint a scenario. Sometimes a husband is annoyed or angered by something his wife does or doesn't do. Would you approve or disapprove if a husband hit or beat his wife in this particular situation? And then we've painted these 5 scenarios. If she goes out of the house or the compound without telling him, if she neglects the children, if she argues with him, if she refuses to have sex with him, and if she doesn't cook the food properly. And we know from other surveys that have been done in Nigeria, some of those, for example, not cooking the food properly, there are quite high expectations that it would be normal for the husband to beat the wife, and that the wife would expect to be beaten. To add some more depth to that, we've asked particularly the situation in your household, question 6.06, and then to try and ask the questions that relate to other people in the reference group. In other families, how often do you think it happens? And then to make sure that the answers are not just coming through by rote, we've had some checking questions whereby we've asked some questions unrelated to the issue we're dealing with. Who's my favourite musician? Do I have family living abroad? And then we get to the 5th part, I hit or slapped a woman in the last month. So these are questions, obviously, those would apply to a man, but they help make sure that we're getting some more depth in the answering, which we can then follow up again in the qualitative survey work. Survey is long and complicated. We're dealing with 3 areas of social norms, and because we're collecting both empirical and normative data, we're collecting it about male 16 to 25-year-olds, we're collecting it from female 16 to 25-year-olds, and we're collecting it in 4 states. It's a very multifactorial survey. So just to give you a flavour of the sort of results that we're getting, this is the baseline results that we've got averaged across all 4 states, and we've seen some different behaviours for the different norms in different states. This is the average across for men and the average across for women in relation to the hitting women question. So we see that 27%, I was going to say only 27%, but 27% is still too much, but 27% of men do hit a woman for one of the 5 reasons I previously outlined. However, 57% of them think that other men beat their wives, and they think that, and 43% of them think that that their neighbours think that they beat their wives, and 25% of men think that it's acceptable to do that, and they think that, and 25% think that their neighbours think it's acceptable. That normative figure is about the same for women, the bottom row. 22% of women think that they should be beaten if they contravene one of those 5 norm areas, and 22% think that others do. Where we start to see some difference is that 40% of women say that they're subject to domestic violence, compared to 27% of men saying that they're involved in domestic violence. So women seem to be seeing it at a higher level than men. But we've got about the same level, 57% for men and 60% for women, in terms of what they think is happening in their neighbours' households. We think this is quite important, and we think it says quite a lot about the messaging that we need to be doing in the programme. It's showing that the sort of most people understand that it is wrong, and most people think it's happening more frequently to others than it is in their own households. So therefore, most households think that they're sort of in the modern minority of not practicing domestic violence. So in our programming around using radio communications, a soap opera, around the work we're doing on social media, we've realised that we shouldn't be having storylines which have domestic violence as a common feature, because that would exacerbate this belief that it occurs frequently in other households, and we should actually be down to at the lower sort of 27 to 40%, recognising that it's less frequent, it's unusual, and most people think that it shouldn't be happening. The sort of the 25% and the 22%, most people think it shouldn't be happening. So that's the aspect of the social norm we should be playing to in our programming. And so sort of, this slide is saying that the learning that we've got from our baseline survey has been very informative for our content work on our video and social media. We've had some quite interesting findings around how acceptable men and women think it is for women to participate in the political space, and quite large differences between the north and south of Nigeria. So this stuff is feeding in real time into our messaging, and we'll be coming back over the next 3 years for further annual follow-up to see if the messaging is having any effect. And obviously that's the purposes of us doing this survey. We're not doing it for research purposes. We're doing it to assess whether the V4C project we're working on is having any effect. And then finally, just to say, when working with radio, we found it quite challenging to find counterfactuals, because the broadcast footprint of radio stations in Nigeria is quite large. So most communities in the state in which the radio station is broadcasting receive the radio. So we've got another study which goes alongside this one, which is a Doseresponse study, trying to understand the efficacy of the frequency of listening to our radio shows. That is it from Aneka and myself. Thank you very much for listening. We'll look forward to your questions in due course.
Thank you very much, Julian, for a fascinating presentation. Actually, thank you both for keeping the time too. Please keep your questions for after Nancy's presentation, and then we will be able to discuss everything. So, Nancy, over to you.
So first, let me start by, this is a project that's a collaboration that is led by UNICEF headquarters in New York in partnership with UNICEF Somalia and UNICEF South Sudan, and their local implementing partners. And Johns Hopkins is providing the collaboration on the impact evaluation and some of the training related to collecting the information. So let me just give you a little bit of information about this UNICEF-led project on social norms change. And we are trying to, we call it Communities Care. That's the name that was selected by the teams and country. And the project aims to advance and implement approaches to really move primary prevention and response to GVB forward in these settings. Especially for this project, we're looking primarily at sexual violence against women and girls in these conflict and post-conflict settings. And we also are focusing on strengthening systems within these communities that support women and girls who are identified and seek services. And strengthening positive social norms that protect the women and girls from violence, and then leveraging the societal dynamics to change these norms that serve to hide or actually encourage forms of violence. And we'll talk more about that. We are emphasizing strengthening the specific sectors within the communities, the health, psychosocial, education, security, and justice system. So as we focus on this work, changing social norms, for example, if we are working to reduce stigma associated with reporting sexual violence, we want to also make sure that the sectors such as the police system and the health system, that a survivor does not go into those sectors and are treated with disrespect or experience discrimination or humiliated. So the response has to keep up with the primary prevention efforts. So we believe that we have to focus on both prevention, primary prevention, social norms change, and then also the response to survivors to improve for the long-term sustainability of this work. So this is just UNICEF's theory of change for this program. It's quite detailed and looks very linear, and we know that in these settings, especially these are very dynamic settings, as you know, every day there are challenges in the settings of where we're working, for example, in Mogadishu and in the areas of Yei and Warup in South Sudan. There's ongoing conflict. There's a lot of fear and distrust of government and systems that are supposed to be protecting, and there's significant displacement of the population. So this is an ideal approach, and we are certainly at times having to slow things down in areas where services, mapping of services change because of the conflict and NGOs having to move out for safety, et cetera. But this is the ideal where we're working on understanding the current practices and around violence and in these communities. We're doing research. We're looking at it. This is an impact evaluation, and we're looking at research on these social norms. What is practiced by whom, how, and why? We have been mapping, and we've completed this mapping. The services in these areas, certainly raising issues and then not providing services to the community members is not what we want to do. So there has to be at least a minimal level of services to support women and girls who come forward. And then facilitating discussions through the intervention to inform people about harms and inform people about their rights, supporting norms that question and the questioning the existing norms, support collective action and public commitments to new norms and practices, connecting people to social and economic protection, so connecting people to services, and then really reinforcing those new norms that are developed and practices and for sustainability and stability. And so that is an ongoing iterative process, and we think it takes a significant amount of time, certainly, and this is a 3-year project. The strategic approach or the intervention that was developed by UNICEF in partnership with the countries is really a toolkit to be used across humanitarian settings, especially where we really are focused in conflict and post-conflict settings. It's really to help guide the primary prevention efforts that are targeting social norms related to sexual violence. And certainly this brings up other forms of gender-based violence, and then also enhancing or strengthening through a social norms approach the comprehensive community-based response to gender-based violence. And at the same time, we recognize that we have to strengthen policies and practices, certainly in education, peace building, child protection, health and legal response, and conflict affecting context. So working with all the sectors around and training and focusing on what are social norms, what is this approach, and it's critical in a sustainable model. So let's just give you the overall program strategy, where we're linking the work on social norms, interventions around social norms, and also the community approach through the multiple sectors, with the goal of reducing exposure to and perpetration of gender-based violence and increasing access and use of services by survivors. And these services being survivor-centered across the multiple sectors. So let me just talk a little bit about our impact evaluation with our overall objectives. So we are in the process of evaluating the community cares intervention in Somalia and South Sudan. So in Somalia, we are focused in Mogadishu at this time only. Certainly, it's a large city, and we are in several areas within the city. In those areas that we have mapped that have support from our implementing partners that provide our services in the health sector. We can do training in the education sector, as well as partnering with police and the peacekeeping forces in the area. In South Sudan, we're in two regions. We're focused in Yei, in Warap, and working with local implementing partners and the sectors to multi-sector partners, and certainly the government in both of these countries to implement. We are looking at a longitudinal design. So we are at midline right now. We did baseline data collection in both countries, in all areas. We have both intervention areas and delay control, which means they'll get the intervention once we finish the last data collection, the endline. And with assessments, we're assessing baseline. We completed randomly selected households in the intervention and control communities in both the countries. We are also doing baseline interviews and follow-up interviews with participants in the intervention, and also with the service providers across the multiple sectors. And then we are also focusing on women who access, especially health services. We're doing exit interviews with women who access health services, and also looking around identification and the services they provided if they come in to report violence. And our primary outcome, which I'll focus on, is the change in social norms towards sexual violence and other forms of gender-based violence. Just like Voices for Change, we have used a mixed method process, and in phase one, one thing we recognized when we started this work is we were struggling with how do you measure social norms in this context and what measures were available, and we did quite a bit of searching and talking with programs and struggled to find a measure that we felt would be appropriate in discussions with our partners. So we set out together to develop a measure that could be used in humanitarian context and ideally be used in multiple contexts, that we could use the same measure in Somalia that we used in South Sudan. And so that was our challenge to really to develop. And so again, this takes time. This was a process, and so none of this can be done quickly. This took about a year, about 8 months really to a year to really develop this. And it started with working with in-country teams, identifying key stakeholders from religious leaders to women's groups to men's groups to youth, and then all the sector representatives from all the sectors that are engaged in providing service to survivors, and really examining what they believe social norms are, identifying what norms they think are protective from within a family, protective of sexual violence and other forms of gender-based violence, and then could put women at risk for violence. And for example, we heard a lot from women and men that education was protective, girls' education was protective, and girls that weren't educated puts them at risk. That's an example of, and there are many other discussions that we had about family honor, about a husband's right within the household, as well as gender equity, and then sexual violence and how it's seen in the community. And then with these interviews and focus groups, so we did individual interviews if a person was not interested, did not feel comfortable talking in a group. Certainly these were not mixed gendered groups, so we felt like that was important. So women and men could express themselves without concerns related to, a man hearing what they're saying or a woman not feeling comfortable talking in front of men, or vice versa. So we developed from the transcripts from these interviews, we developed common themes that we heard around family honor, for example, around gender equity, dignity, husband's rights, sexual violence, and we wrote items or questions to reflect those themes. And then we worked with the in-country partners to review the questions and develop a tool to measure social change. So the next phase, when we had a draft of this tool that we then, of course, had to translate and work on the translation and pilot test. So the next phase was testing this measure. Is it reliable? Do participants answer the items consistently? And is it valid? Do items go together as we expected them? And these are really important reliability and validity of your measure is really important in making sure, are you really measuring social norms? Are you measuring what you think you're measuring? And so we did this analysis to focus on the refinement of the measure and to establish the psychometric properties or the reliability and the validity prior to doing any baseline data collection for the evaluation. Because, it's really important if you're trying to change, if your intervention, you're trying to change social norms and you have a measure that's not measuring social norms, you're not going to see the impact of your intervention no matter how good your intervention is. So it's really important to have a reliable and valid measure. So the other thing really important we think in measuring, especially, our long-term goal is for this to be integrated into monitoring and evaluation programs that are focused on primary prevention using a social norms approach. So this could be used in other settings, scaled up. And so it needs to be brief. But again, reliable and valid, and it can and should be able to be administered, across multiple settings, countries, and within countries. So what we have now, and what we, after multiple iterations, I won't go through all the process, but we've been out in the field, pilot testing it, retesting it, refining it. We're now at 18 items that ask questions in 4 areas, which we descriptively named sexual violence or gender-based violence, family honor, gender equity, and husband's rights. Now, these are what we would consider on a measure subscales. These names we gave the subscales. Another team might name them something else, but this is a descriptive name that really we try to capture the content of those items in these sub-4 areas. So the 18 items important is, again, because we want it to be brief, but we're having, as Voices for Change talked about, we have to ask these questions from different perspectives. And so we are asking these 18 items from 3 perspectives. And that's a challenge when you're out in the community. And it sounds like we're asking the same question over and over. So you have to really work with your teams, training your teams on what is the difference and how we're asking these questions so that they can explain to the participants so that they can keep them engaged and in the process. So the first perspective we're looking at is the influential others, that network, what do you think people who are important to you expect you to do? And some of the work going back to the qualitative work is, some of that work was who in the community is influential and influences these norms related to violence against women and girls for protection and also for sustaining those norms that are not protective or harmful. So the second perspective is we asked about their own personal beliefs related to those norms. So what they believe related to reporting sexual violence to authorities, for example, and what is happening, what they're seeing, what is happening in their community related to those norms. So we're asking from these 3 perspectives the same 18 questions, and we are asking on the survey who are their influential others related to the norms around gender-based violence, sexual violence. And so this information certainly also helps us in refining the intervention. Who are we going to target in those initial discussion groups, for example? If a mother or father or religious leader is considered to be most influential around social norms or peer groups, then we want to make sure that we're targeting those groups in the initial development of implementation of intervention. So let me just give you an example for family honor. So from this perspective of what do you think people who are important to you expect you to do? So as Voices of Change has shown in their theory of change, is this is dynamic, and people don't go from having a harmful, supporting harmful norms to automatically moving to protective social norms. There's a process that we think happens of that contemplation, the moving to action. And so we developed the responses to these questions are on a Likert or Likert scale from, agree to strongly disagree to strongly agree, and the choices in between. But we expect a woman and girl to only report sexual violence if they have serious physical injuries, expect a husband or father to retaliate against alleged perpetrators, expect a woman's reputation will be damaged if she reports sexual violence to authorities or elders, expect women and girls to not report rape to protect the family dignity, expect sexual violence to be handled with the family and not report it to authorities, and they fear the stigma if they were to report sexual violence. And how we score this subscale as part of the 18 items. So the family honor has 6 items, and we're asking this again from the 3 perspectives. And the higher scores indicate, in this case, that participants think more of the people who are important to them or influential to them endorse protecting family honor as a norm over, we would say, over than having young women and girls reporting sexual violence. And so how do we shift that norm to protecting the young woman rather than protecting the family honor? So we are now in phase 3, and this is, as you can imagine, in the settings that we're working, is challenging. It's certainly ever-changing, and I can't say enough about our in-country implementing partners who have collected data and throughout the challenges, and we are trying to provide the evidence to support the community cares program before scaling it up to other countries' humanitarian settings. So again, can an intervention such as community cares, where we're working at the level of the community as well as the sectors, individuals, can we change norms and improve services to survivors? And we are both in intervention and delay control sites in Somalia and South Sudan. So how this works in the impact evaluation is participants consent in our survey prior to starting the community cares program. And so we are sampling at the household level, random sample from each community, 800 men and women. And community discussions we're interviewing the community discussion participants. These are the participants that are actually engaged in the intervention, which is a 15-week program around changing social norms. We are also interviewing service providers who participated in the training. And then at midline, we go back and we re-interview the 800 men and women who we first interviewed in the community, and we have a very intensive retention process. And I was just talking with the South Sudan team, and at midline, they've been able to retain 84% of the sample. And that's quite a challenge given that we've seen displacement related to conflict and people moving closer into the urban areas from rural areas for safety. So it says a lot about the team's effort and the quality of their work. And we're seeing the same level of retention, close to that in Somalia. And that's really important to look to see change over time is the retention rates of the participants. And then we're also, we completed the 15-week program for the first round in both Somalia and South Sudan, and we're now doing follow-up with participants as they move into the action stage, where they start to take what they learned in that intervention groups and are now moving into taking actions based on their group discussions. And that data collection is in progress. And we are then going to have an inline, which will be 12 months after the baseline. We are also talking with UNICEF about another round of data collection, because as I think Voices for Change and all of us are recognizing, social norms change is a long process and takes time. And most of our projects are not following or not able to. We don't have the funding and resources to continue to follow the communities out 3, 4, 5, 6 years. And I think that that's really going to be critical to show the impact of these interventions as they continue to grow and are scaled up. So thank you very much.
Thank you very much, Nancy, for the presentation. As we can see from these two presentations, we have heard the use of social norms for two sort of different aims. In the first one, they are trying to understand social norms so they can target their interventions and their messages and try to establish reference groups. In the second one, we are using social norms to see the social norms change before and after an intervention. So it's quite fascinating to hear the use of this very useful approach to two different areas. And hopefully we, with LINEA, we will try to use social norms to prevent sexual exploitation of children. Now, I would like to turn to the participants, because I'm sure you have lots of interesting questions. So we have a question from Gert. There's a query about the first case in Nigeria. So there are 3 questions to be asked. What do I do? What do other peers do? And what do others think I do? Which one of these 3 types of questions gives probably the best view of the change in social norms in the community? So Emeka or Gillian, please.
It's a really good question. Those are the 3 questions we have to ask to triangulate what's happening. And it really depends whether the particular practice is being mediated as a social norm. So how much is it under the influence of peers and peer pressure, and how much of it is it something that people can do themselves? So at the moment, what we're trying to work out is the answer to that question. Are particular practices more affected by the social norm, the peer pressure, than others? And so we don't know at the moment. That's sort of part of the research is trying to understand which of those is the most important, and the sort of the difference between the 3 areas we're looking at, which is gender-based violence, domestic decision-making, and women's political representation, is that gender-based violence and decision-making are much more within a private space. So it's not always possible to know what your neighbours are doing. You can make supposition about it, but it's not always easy to know exactly what they're doing, whereas women's participation in political spaces is much more obvious to everyone. So sort of one of the hypotheses may be that the political one is more affected by what my peers think of me than ones which are more private. But we have yet to prove that. We're not quite sure.
Thank you, Julian. We have another question from Madhumita. Okay, so I read it aloud. How different we are trying to capture norms from what has been done since long as part of the GEM scale? So Nancy or Emeka, would you like to answer that question, or Gillian?
So this is Nancy. The GEM scale is developed by colleagues at Gary Barker and his team, looking at I think it's gender equity
measure.
Measure. So from my understanding and my perspective, I'm certainly I think as many of us are learning really around how do you measure social norms. That measure is really about attitudes and belief. And it doesn't ask, we're trying to get a social norm that's influenced by, what people expect you to do, and as well the perspective that we're trying to get on how influential others in your community, your mothers, your fathers, your religious leaders, how they expect you to respond. And then, so the GEM measure from my understanding, doesn't provide those perspectives in really measuring social norm change. And so that's why we felt that it was critical to develop a measure that really, from a qualitative approach, we work with communities about what are social norms, how do you define them, and that's, some of this, how is it different from an attitude or belief, and is it really different? I mean, it's a very complex issue that we're all sort of working on how to operationalize and how to measure. So I don't know that we have it right, but I do know the GEM measure would not be considered a social norms measure.
Yes, definitely. Could I just add, I think theoretically attitudes are at the core of social norms, but they are not the same. And it's the interdependency aspect which is so important, because we have found that just changing attitudes doesn't necessarily change behavior. So the approach of social norms is trying to understand how others, the ones that surround you, are important to you, might have an impact on your behavior. And I think that's the main difference. So we have another question from Coyote. So social norms change often takes time. How have we managed expectations for ambitious log frame results, reporting which is often within a short period of time, compared to the longer-term change social norms delivers? Also, are annual surveys realistic to measure large change? If not, what can be the standard frequency for such surveys?
Okay, so I am in complete agreement. Social norms change is definitely a progress, and it's dynamic because we're measuring communities, and there's all kinds of things happening in these communities that can influence norms and the change in norms events. And certainly in an area where there's conflict and it's so dynamic, different governments are coming in, peacekeepers, different perspectives are coming into communities. We see changes. People talk about the changes in community changes and family changes and structures, and that can be quite fast. And so how do you capture these changes in a place that's very dynamic versus a place that's more stable and doesn't have all these extra other influences? And I think that's the challenge we're having in the setting Somalia and South Sudan, because every day, there's events that really impact the community, as well as there's a lot more conversation around sexual violence, but it's often in the context of violence by military groups, sexual violence perpetrated by armed actors, rather than we hear very little about intimate partner violence or sexual violence committed by family members. So these are some of the challenges in changing the norms is this work as well. It is frustrating, I think, for many of us that know it's going to take a while and that we just don't have funding that's going to support that long-term follow-up. So one of our goals was to develop a measure that could be worked into programming as a regular part of their monitoring evaluation that they do for their ongoing projects of sustainability. I'm not sure that this is the measure, but I think it has to be brief. It has to match with ongoing other program monitoring evaluation plans, so it can be well integrated and isn't a standalone. And that's what we're trying to get to that measure. And remember, we're looking at post-conflict and conflict settings, so it may not be as a good measure in these other settings, but I think it's a starting point for folks to move forward.
Thank you. And I think Julian wants to add to this, and maybe, Julian, you can address the follow-up question from Coyote of what are the implications for reporting to donors?
Yeah, sure. Thanks very much, and thanks, Nancy. I think we're very lucky, I would say, in Voices for Change, that we're funded by DFID, and they recognise that this is quite an experimental programme. And when they framed it to secure the funding from London, it was framed as the first 4 years of a 20-year initiative. Obviously, sort of politics are what they are, and it remains to be seen whether we'll get the subsequent phases of the programme. But from the very beginning, it was recognised this is a 20-year initiative, so there weren't huge expectations about social norms. They also recognised that what we're doing is quite experimental, both in terms of how you change social norms and in terms of how you measure them. So very specifically, Coyote, you asked about the log frame, and in the log frame, we left the social norms changes blank, and we said that we would start to fill in the data around annual changes and the target change over the life of the programme once we had baseline information. So we've now just got baseline information, so we've started to put a change trajectory in place. But we've explained to DFID very clearly that we wouldn't really put things in solidly until we had one more year's data. So we had at least 2 points of data and we could see what the change trajectory was. We've also crafted the indicators around the 3 different norm changes. So we realized that some of the norms change more quickly than the others. And then the third thing to say is that the program is not just about social norms. It's actually using Laurie Heiss's ecological model as its theory of change. So we're trying to change girls themselves and build their self-esteem from the inside. And we're working on the legal and political budget framework from the outside, and we're working on social norms in the middle. So we've managed to give DFID some quick wins around helping Nigeria pass bills for gender and equal opportunities and Violence Against the Person Prohibition Act. And we've also got some quick wins about the number of boys and girls participating in safe spaces. So some of the pressure on social norm change is off us from the log frame perspective because we're delivering results in other areas. But overall, I would say that DFID recognises what we're doing is very innovative/experimental. So they're happy for us to sort of develop a set of targets as we go along.
Okay, thank you so much, Julian. We've reached now an hour, and I'm aware that I don't want to keep you, but thank you. I want to thank the presenters. I want to thank all the participants. Thank you for your interesting questions. Obviously, we would like to keep talking about this, but the conversation is just starting, and hopefully this has provided a lot of food for thought.